Now students, in today's lecture, we are going to study the pathological variations in ESR, that is erythrocyte sedimentation rate, and the mechanism of ESR as well. So, what happens in ESR? What are the reasons for the changes in values of ESR? So, there will be increase in ESR, that is erythrocyte sedimentation rate, in case of tuberculosis, anemia except sickle cell anemia, malignant tumor, rheumatoid arthritis, rheumatic fever, and liver diseases. However, there will be a decrease in ESR in case of allergic conditions, sickle cell anemia, peptone shock. Whenever there is a partial hydrolysis of protein, there will be production of peptones now. In case of polycythemia, there will be also decreasing ESR level. What is polycythemia? In polycythemia, there is increased concentration of hemoglobin in the blood. Now, sphere leukocytosis. Leukocytosis is actually the condition in which the white blood cell is above the normal range in the blood. So, all these five reasons, all these five conditions may result in decrease in the level of ESR. Now, what is the mechanism of ESR? How the blood RBCs undergo Rolex formation. So, we have already discussed that our RBCs are well defined, well structured, and these RBCs contain a group that is sialic acid, and this sialic acid is actually a negatively charged group. So in whole, we can say that normal RBCs don't Rolex due to the negative charge, which is on their surface, which causes these RBCs to repel one another. So due to this negative charge, these RBCs will repel one another. However, we know that in our plasma, we have a protein that is fibrinogen. So the plasma protein that is fibrinogen has ability to adhere to the red blood cells. It means if the fibrinogen is adhering itself to the red blood cells, it means your fibrinogen contains a charge that is positive charge. So this plasma protein, this fibrinogen, which is now adhered to the red blood cell, will try to neutralize the surface negative charge of the red blood cells, thus promoting the cell adherence, thus promoting the Rolex formation. So this fibrinogen is actually the reason behind the Rolex formation of the RBCs. So this is all about the pathological variations of ESR and the mechanism of ESR, the reason behind the Rolex formation of the red blood cells.